Good morning. I'm Dr. Marcus Masson from the Reconstructive Orthopedic Center in Houston. I'm an upper extremity orthopedic surgeon specializing in trauma. Because of this horrendous virus, we have been forced to carefully treat our patients with significant injuries that are requiring urgent and emergency needs. In this process of treating the patients, I've had to train my employees to, number one, not be afraid of what is happening, and two, to follow strict protocols. And it occurred to me during this process that the information I've handed to them may be helpful to the community at large, which filters out a lot of the information that may be confusing. With that in mind, I'd like to share with you how to implement certain protocols of safety for the benefit of the average citizen. Thank you. The current talk is about response to COVID-19. Today's date is March 30th, 2020. Our agenda today is to talk about what is at stake, definitions, facts to make decisions, and actions to take. What is at stake is our health, the health of our loved ones, and our way of life and economic viability. What is important is the truth. Facts and truth is the foundation of everything, all relationships, all decisions, all actions, all results. To understand what has been going on and to understand the words that are being used by many, I'd like to review a few of the epidemiologic definitions. An epidemic is a rapidly spreading disease to a large number of people in a given population within a short period of time. A pandemic is similar, however, it affects everyone worldwide, and because it's usually a new strain that comes out, there's no pre-existing immunity. Community spread occurs when the virus affects people in an area, including when the source of the infection is unknown. The incubation period is the time between exposure to when symptoms first appear. Latency is the period between exposure and when someone is infectious without symptoms. And finally, latency for viruses is approximately 5 days with a range of 2 to 14 days. However, this is not the main method of spread. Prevalence is the total number of cases of a disease in a given area during a given period of time, or how widespread the disease is. The incidence is the number of new cases in a period of time, considering the population at risk. To quarantine is the physical separation of a person or group of people who have been exposed to a contagious disease but have not developed symptoms from others who have been exposed, in order to prevent the possible spread of that disease. And virulence means how deadly or harmful a disease is, or chemical or item can be. Epidemiologic facts include that in the past century, there have been approximately 4 influenza virus pandemics that have caused the emergence of a novel influenza virus. This is the first pandemic known to have been caused by the emergence of a new coronavirus, and cases are now being detected worldwide. COVID-19, the disease, is spreading easily and sustainably in the community, called community spread, because it is a new virus with no human natural immunity and no effective immunization in sight. The true prevalence and incidence is unknown and unknowable unless large numbers are tested in different areas of the population due to the lack of testing. Those with mild symptoms or asymptomatic carriers are unknown. The current numbers provided are best estimates, and it could be better or worse. The recent history of coronavirus is the following. In December 31st, 2019, in Wuhan, Hubei, China, the Hunan seafood wholesale market, which also sells live animals, a cluster of pneumonia cases occurred that was later identified as the coronavirus, now called SARS-CoV-2, and the disease as was named coronavirus 2019, abbreviated as COVID-19. SARS-CoV-2 is a family of coronaviruses that originated from bats, which are the only flying mammals, which have then spread to other mammals, now including humans. 2 similar examples of the coronavirus in the Middle East is MERS, which originated from camels and primarily affects individuals in Saudi Arabia in 2012, and is called camel flu, which is extremely virulent, and also severe acute respiratory syndrome, SARS, which originated in 2002 in Wuhan province, China, originating from horseshoe bats. Coronavirus is one of the many viruses that can cause the common cold. Rhinovirus is 50% of the common cold. Coronavirus, respiratory syncytial virus, and influenza and parainfluenza cause similar cold-like symptoms. Human coronavirus types are named because of the crown-like spikes on their surface. There are four main subgroups of the coronaviruses known as alpha, beta, gamma, and delta. Human coronaviruses were first identified in the mid-1960s. Further facts of the coronavirus: there are 7 coronaviruses, 4 human coronaviruses that spread from human to human, and 3 human coronaviruses that have spread from animals. The 4 coronaviruses from human to human are 2 alpha and 2 beta, as noted above. The ones that have come from animals and affect humans are SARS-CoV that occurred in 2002 in Guangdong, China, MERS-CoV, which is Middle Eastern Respiratory Distress Syndrome that happened in April 2012, and our current SARS-CoV-2, which began in China in December of 2019. The virulence, or how harmful SARS-CoV-2 is, probably more than influenza because, number one, no prior immunity to the new organism exists. There's no vaccine available for at least 1 year, long after the pandemic is gone. And please keep in mind, however, that 81% or so of those contracting the coronavirus will have only mild symptoms. Now, the coronavirus transmission, also referred to as spread, is similar to the influenza from person to person and through close contact from an infected person who coughs, sneezes, or generates respiratory droplets. Human droplets are produced by breathing, talking, sneezing, or coughing. Droplets carry both electrolytes from the mucus and saliva, like sodium, potassium, and chloride, and various infective agents like bacteria, fungi, and viruses, which average approximately 0.125 micrometers. Sneezing may produce as many as 40,000 droplets between 0.5 to 12 micrometers in diameter. Coughing may produce up to 3,000 droplet nuclei, with the same number as talking for 5 minutes. Respiratory droplets greater than 5 micrometers in diameter fall rapidly to the ground and are transmitted less than 1 meter. Between 5 and 10 micrometer deposits into the upper respiratory tract. Droplets greater than 10 micrometer diameters is blocked by the nasal region. Respiratory droplets greater than 5 or less than 5 micrometers in diameter are produced when sneezing and can remain suspended in the air for significant periods of time, allowing them to be transmitted distances greater than 1 meter and remain suspended in the air and can reach the lower respiratory alveoli and cause infection. Respiratory droplets fall rate include 100 micrometers fall in 10 seconds, 40 micrometers in size fall in 1 minute, 20 micrometers in 4 minutes, 10 micrometers in 20 minutes, 5 to 10 micrometers in 30 to 45 minutes, and less than 5 micrometer droplets can be inhaled. Keep in mind that the droplets of sneezing create between 5 to 10 micrometers in size. For this reason, distances of about 6 feet or more from someone coughing or sneezing is recommended. Transmission on surfaces. The coronavirus, please keep in mind, may survive several hours to up to several days at room temperature and stay viable and contagious on a metal, glass, or plastic surface. For this reason, when outside your home and not wearing gloves, if you contact surfaces, wash your hands as soon as you come home and clean your surfaces at least daily. Now, things to understand regarding transmission is that food transmission is considered low risk and there is no current evidence to support transmission in cooked food. Drinking water has not been detected and conventional water treatment methods are used. and filtration and disinfectant methods that are currently available in the United States. No evidence exists of companion animals, including pets, that can spread COVID-19. That is not to say that we don't take precautions when we are infected in treating our animals. Letters of packages from China, according to the World Health Organization, is safe to receive because research has found that coronavirus doesn't survive long on objects such as letters and packages, based on what is known about MERS and SARS. Fecal-oral transmission has not been reported to date. Use of pools and hot tubs have no evidence of spread to humans. Proper operation, maintenance, and disinfection is assumed with this comment. Warm weather effects are unknown. Symptoms of the coronavirus are the following. Fever is almost 90%, and please keep in mind that fever is defined as a temperature of 100.4 or higher, and that our normal temperature is 98.6. Dry cough occurs in 67.7%, fatigue or feeling tired in 38.1%, sputum production 33.4%. These are the highest four symptoms to keep in mind. Now, shortness of breath, 18.6, is a symptom of more moderate to severe disease presence, and muscle and joint pain, 14.8%. Sore throat, 13.9%, headache, 13.6%, chills, and so on. And keep in mind that these are all flu-like symptoms. Regarding testing, the FDA released testing on March 14, 2020, and because of this, the incidence and prevalence is not truly accurately known. The test is a reverse transcription polymerase chain reaction for RNA virus. Testing methods are through respiratory specimens, nasal or oral swabs. Testing is believed to be 71% sensitive, meaning that approximately a third is inaccurate. Testing sites can be found at https://findahealthcenter.hrsa.gov. This is a testing center that has capability in your area. Note that not all clinics and emergency centers have testing capacity. Testing is recommended for all high-risk individuals with flu-like symptoms, those with or without symptoms exposed to high-risk areas, and all individuals moderately sick with flu-like symptoms. Now, flattening the curve has been in the media and has been discussed thoroughly. However, let's talk about what that means. Please keep in mind that the purpose of flattening the curve is to prevent deaths of high-risk, immunosuppressed, and very elderly patients in their mid-80s infected with COVID. Flattening the curve eliminates having to decide who lives and who dies. Flattening the peak of the bell-shaped curve means that the number of cases that occur at a given time are lessened so that the medical industry is not overwhelmed by lack of resources, particularly ventilators, which are in scarce quantity. Flattening the curve allows medical personnel to treat those with respiratory distress syndrome because there is no pharmaceutical treatment for ARDS, and allows also the local government and federal government to mobilize resources to most areas of need. Regarding prevention, prevention begins with elimination of fear and understanding what are the facts and being disciplined with the application of the facts. It starts with social distancing, so no unnecessary gatherings are recommended. Avoid unnecessary travel, especially cruise ships. Do not share. You should not share dishes, drinking glasses, cups, eating utensils, towels in your home. Don't shake hands, hug, or kiss anyone you do not know or at risk, and use discretion with loved ones. Stock up on home supplies like food and essentials and over-the-counter medication and medical supplies to treat symptoms and limit outside exposure and frequency of gathering these necessary resources. Prevention of asymptomatic people are the following. It is unknown whether closing schools will substantially reduce spread of the coronavirus, but we are taking these measures. 6-foot rule is when noticing someone coughing or sneezing, you should stand at least 2 meters or 6 feet from them. Avoid close contact, defined as being within approximately 6 feet, for a prolonged period of time with someone suspected of having COVID-19. Avoid handshaking with people. As much as possible, avoid high-touch surfaces in public areas like elevator buttons, door handles, handrails, and use a tissue or sleeve to cover your nose and mouth when you're sneezing or coughing. Please be respectful of others. Fearing and anxiety about COVID-19 can cause people to avoid or reject certain racial classes. Please keep in mind, this is a humanitarian effort. In reference to washing hands, it should be done at least 20 seconds after touching unknown surfaces. Do not put your hands in your mouth, nose, or eyes after contacting unknown surfaces. And wash your hands every time you come from the outside into your home. Cleaning surfaces. Worst case is that 9-day contamination period on surfaces of COVID-19. So for this reason, we recommend that you clean your surface at home once a day. In our medical practice, we clean our surfaces every hour on the hour. Correct cleaners must have at least 60% alcohol, and if you run out, you can use Clorox bleach with the combination mixtures that you see. Bleach has 5.25% to 6.15% sodium hypochlorite diluted in water. There are 30 cc's per ounce, and 8 ounces is a cup, and 230 cc's in a cup. You can use a dilution of 1 to 10, which is prepared by 1.5 cups of bleach in a gallon of water, or 1 to 100 dilution, which is still effective and is approximately 1/4 cup or 60 cc's of bleach in a gallon of water. Our preparation in our office is 20 cc's of bleach in 900 cc's of water, which is a quart, and it equals approximately 80 cc's per gallon. Regarding the N95 respirator masks, please note that it is the best protection through airborne particles when there is good facial seal. It is most commonly used in the industries and healthcare industries. The N95 filters dust, mist, and also fumes. The masks have filtration efficiencies that vary by manufacturer, but particle size filtration capacity is 0.1 to 0.3 micrometers, which is at least 95% efficient at that size of sodium chloride particles. Filtration efficiency increases with particle size and reaches approximately 99.5% or higher for 0.75 micrometer particles. Mycobacterium tuberculosis tests show that filtration efficiencies with these masks are 99.5% or higher. Current recommendations is to wear a mask if you're healthy and taking care of a person with suspected or known coronavirus infection. Wear a mask if you're coughing or sneezing, and if you have to go to your doctor, whether inside or outside your home. Inside your home, also use designated areas, including designated bathrooms if available. Masks are effective only if used in combination with frequent hand washing, and also should be removed from the back of the mask and then discarded immediately in a waste bin. Current treatment for coronavirus is none. There's no antiviral treatment or vaccine available. Certain different measures are being tried. There is no vaccine available, and there is some recent research in France regarding a combination of Plaquenil and an antibiotic. However, this has not been validated throughout the World Health Organization and others. Regarding treatment, using available preliminary data, the median time for the onset to clinical recovery from all cases is approximately 2 weeks, but can range from 3 to 6 weeks for patients with severe or critical disease. If you have mild symptoms, self-isolate, which means quarantine yourself at home, and treat symptoms with over-the-counter medications. If symptoms are moderate, for example, coughing and fever and respiratory distress is starting to increase, then see your primary care doctor and wear a mask. Severe flu symptoms, go to the emergency room for testing and treatment. But please, be logical. Control your fears with facts. Ask your supervisors or medical physicians if there are concerns, and make no assumptions. Manage yourself, but help others when possible, and be part of the solution and not the problem. Regarding communication, you should have communication with your family members and be informed on a daily basis by going to the area of primary reputable sources. This includes the Center of Disease Control, or the CDC, the World Health Organization, WHO, the U.S. Department of Health and Human Services, the State Department, and local government. Please keep in mind that these recommendations are for practical reasoning of the available information, but keep in mind that you should follow the local rules and federal rules in order to behave accordingly. In summary, please note that infection is only transmitted through aerosol droplets or direct contact to your eyes, nose, or mouth. Practice social distancing and limit unnecessary travel. The 6-foot rule when witnessing coughing or sneezing should be followed, and keep in mind how long the particles remain suspended. N95 masks if infected or suspected of being infected or healthy and taking care of someone infected should be worn. Wash your hands for at least 20 seconds each time you are outside and touch unknown surfaces. Self-quarantine if you have flu-like symptoms and they're mild. Seek medical attention if moderate symptoms occur and are progressive so you can get testing and appropriate treatment. Go to an emergency room if you're having respiratory compromise, bluish discoloration, or shortness of breath. Go to reputable sites for accurate information, and do your part. Be part of the solution and not part of the problem.